Hi, welcome back to our Dental Spotlight. I'm Dr. Sharma from Provident Dentistry.
Hi, I'm Renee. I'm a hygienist at Provident Dentistry at Canton Park.
Today we're going to talk about sleep apnea. Now, what is sleep apnea? It is potentially a serious sleep disorder in which breathing is repeatedly stopped and then it starts again. So if you snore loudly and feel tired even after a full night's sleep, you may have obstructive sleep apnea.
The most common form is called obstructive sleep apnea, and the two most common risk factors are obesity or excessive weight. What happens is the throat, the tongue, the muscles relax and it moves to the back of the throat and can cause obstruction of the airway while you're sleeping.
Exactly, that's especially when you sleep on your back.
Yes.
Some other causes are some hereditary problems like a thick neck or a narrow throat, a round head, allergies, and a deviated septum.
In some cases, smoking, drinking alcohol, sedatives can contribute to sleep apnea.
Yeah. Syndromes can be associated with sleep apnea. You can ask your doctor more about that.
Children can be affected mainly due to tonsils, adenoids, obesity, and large overbites.
Absolutely. Men are mainly more affected with sleep apnea than women do. Women are affected during pregnancy or after menopause. That's when you can mainly see the sleep apnea problems. The ethnicity is the main thing too, like African Americans, Hispanic. But again, it comes down to overweight and obesity.
Some complications related to obstructive sleep apnea are high blood pressure, stroke, heart disease, heart attacks, diabetes, reflux, nocturnal angina, heart failure, and hypothyroidism.
Absolutely. If it does go untreated, there is an increased risk of heart disease, heart-related illnesses, and then even death. It increases daytime tiredness, increase the risk of road accidents, depression.
It can cause worsening of heart failure due to the elevation of the stress hormone.
Yeah. Let's talk about the treatment of sleep apnea. The main treatment is that a CPAP machine, which you will talk to your doctor about, and they'll fit you with one of those. It could be just a tube that goes in the nostril, over the face, or just on the nose. But depending on what your doctor suggests, they will let you know which is the best CPAP machine for you.
Yeah. For more mild cases, we can actually fit you with an oral appliance right in our dental office, so you can discuss with your dentist there's a couple different options, which option would be best for you.
Yeah. Now, it's very important to wear some form of protection that avoids sleep apnea, either the CPAP or the oral appliance. If someone is in a severe case and they're told that they have to wear a CPAP machine and they absolutely can't wear it, it's very uncomfortable at night, please talk to your dentist. An oral appliance will be replacing the CPAP machine, but something is better than nothing because untreated sleep apnea can cause enlargement of the heart and in some cases death during night times. So we've had a case where someone did tell us that their father died in their sleep, and it was then noted that it was because of his enlarged heart due to untreated sleep apnea. So it's very, very important to treat it and don't let it go untreated at all.
On every patient in our office, we do a visual screening to look for signs of sleep apnea. We check the throat and the neck for signs of obstruction. We look at the tongue to see if it's enlarged or if it has scalloped edges. We also take a look at the teeth if there's signs of wear. You might be clenching during an episode.
We also ask questions that, are you tired during the day while reading a book or watching TV? Do you doze off easily? These are all signs that you do have some kind of a sleep disorder. We do some breathing tests in our office. It just takes 5 minutes. It's free of charge. All you do is you breathe in a tube. It shows some recording of showing how open your airway is. A lot of times patients ask that, why are we as dentists asking these questions? It's because you see us quite often, every 6 months. We look down your throat. We can see signs and symptoms of sleep apnea.
Yeah, and very important to get that treated for the reasons we mentioned.
Yeah. If you have any questions, please don't hesitate to call our office. Thank you.